Hello, everybody. How are you? So, we are going to talk to Liz Buchanan today about weightlifting during pregnancy. So, weightlifting during pregnancy is contraindicated. You look in any book and it will tell you that women need to moderate and not weightlift during pregnancy. Well, Liz, who I'm going to bring in just a minute, I was scrolling through Instagram and I met her through Leslie Logan's program, and I saw her she had to have been 9 months pregnant, we'll find out in a minute, lifting weights. And she was doing it with such perfection and precision that I was like, see, this is a great example of the fact that you can still do the things you want to do. You just have to be really smart about it. So we're going to bring her on right now. Let's see. There you are.
Hello.
How are you doing?
I'm good. How are you?
Good. It's so great to see you. So did you hear my little introduction?
I did, and thank you
Good.
so much for that. That was very nice.
Sure. So that's pretty much the backstory, is that it was watching you with the breathing, with the what I call hug the baby, and being able to execute the way that you did was amazing. So we'll get all into that in a minute, but let's just talk about you for a minute. So your tag is holistic, which I love. And it says that you help women gain confidence through mindset, Pilates, weightlifting, and a healthy relationship with food.
Yes,
So
exactly.
do you want to tell us a little bit about how you got into what you do today?
Oh man, well that's kind of a long story. So let's do let's do the shortened version.
Okay.
I was a theater major and I wanted to be an actress, and I couldn't afford a gym membership, so I started working in one. And then I knew, okay, well, to be an actress, I have to be thin, and I'm not naturally thin. So I started asking a ton of questions, and I think I was just annoying the personal trainers and kind of clinging on to them. And so one of them said, "Why don't you just get certified?" And so I did, and it was kind of like history from there. So
Okay.
yeah.
Okay. And then what got you into Pilates? Because you're a Pilates teacher too, right?
Yes.
Yeah.
So I was working in a gym, and you have to have a specialization as a personal trainer there. And so the fitness manager at the time just said, "Why don't you do Pilates? You'll really like it." And I was like, "Okay, sure." I had done, oh, what's her name now? Great, now I'm blanking. Ah,
That's okay. I'm sure it'll come to you in a minute.
okay.
Yeah.
DVDs, when I was in like ninth grade or something, I started doing Pilates DVDs. And so I was
Mari
like, okay.
Windsor?
No, it was
Oh.
no, she has like the raspy voice. She's usually just a fitness person, blonde hair. Oh, who is she?
Oh,
Can't remember her name.
Joan, is it Joan? Is that her name? Anyway, okay.
No, it's like
I'm sure it'll come to you. Okay, sorry.
so I said, okay, sure. And I went through that certification and really liked it. And then I was like, oh, hey, this really transfers into weight training and everything else that I'm really interested in. And it's helping me become more mindful through all of those things.
Right. So, okay, so may I ask how old you are?
I'm 37.
Okay. Oh, wow. I thought you were a lot younger. That, you're
I
incredibly
wish.
vibrant. You're incredibly vibrant. So this is your first child.
Yes.
Right. Okay.
Hmm.
Do you want to tell us a little bit about your pregnancy journey?
Sure. So it was a really easy pregnancy, especially as far as I hear stories from other people. In the first trimester, I'm still kind of like confused if this is really good or just neutral or not, whatever, but I really didn't feel too sick. I never threw up. I had moments and I had some food aversions, but it was really mild and minor. And then second trimester, I felt great, like everybody usually says. I started feeling some aches and pains towards the end of the second trimester, and then a little bit into the third trimester. Um, and the pregnancy itself was very uneventful. and easy and a healthy pregnancy. And I tried to do the majority of things that I was doing before safely as much as I could.
Right.
So
Right. That's wonderful.
I couldn't water ski. That's one thing.
And have you water skied since?
No,
Not yet.
not yet. Next summer.
So you're how many months postpartum now are you?
3.5 months will be,
Okay.
yeah. So December 4th will be 4 months.
Okay. Okay.
Mm-hmm.
So okay, so you got into weightlifting as you said, a teenager, like watching the DVD, well, Pilates, and then working up to about what age did you start like lifting?
That I like the way that you phrased that, because I would say previous to that, it was not what I would really call lifting. I was learning and I was interested in the weights and I was doing stuff, but I started powerlifting. I was, I think, like 29.
Okay, okay,
Mm-hmm.
okay. And yeah, so tell me a little bit about that.
So that, well, it's interesting. So I started it because I had been bodybuilding previous to that, and that was just not a good, it wasn't good for my mentality. It did not suit me well. It brought out a lot of issues that I had growing up with food and just over exercising and things like that. And I realized that I didn't even like the bodybuilding, which I think I kind of knew all along. I just loved the heavy weights. But at that point, I didn't know about powerlifting. I guess, it wasn't on my radar. And so that just kind of propelled me into, oh, I can just lift heavy weights. And I am an athlete, so I need that competition. So then I just started seeking out some powerlifting competitions, and I never got really serious with it, but it was a really good thing for me to learn and very good outlet.
Okay. Okay. And then what was it about the so you called it bodybuilding. Is that where you're competing?
Yes.
Is that what you mean? Okay.
Mm-hmm.
Okay. And so I see one of the things that you do, you talk about confidence and helping women with like food issues. How was that for you during your pregnancy? I'm sure that you've resolved, it sounds like you've, gone through what you need to go through as far as how to eat, what's the word? Just mentally, not for just nutrition wise, but learning, it sounds like emotionally.
Mm-hmm.
So how was that during your pregnancy as you gained weight, and yeah, how did you process that?
That's a really good question. Not as easily as I would have hoped.
Okay.
So, I think at this point, being a personal trainer for as long as I have been and working with so many people, I am able to kind of step back objectively, even with myself now, and just say, like, this is what's happening in my life. And, this is healthy. Obviously, I want this to happen. So how did I really handle it? I think I'm not totally answering your question. It was a delicate balance of talking to myself and just, like logically saying, this is good. This is what's supposed to happen. But at the same time being like, yeah, I can't wait to get back to me, which is not great for postpartum. I think that that's something that should definitely be talked about with women. Yeah.
Getting back to you postpartum. So right now you're 3.5 months post.
Mm-hmm.
How are you doing now?
So I think still good because, so I'm breastfeeding mostly. And so I haven't done anything like I haven't tracked calories in years. So I didn't do that through pregnancy, which some people like that feedback, and that is good for some people in the sense of making sure you're actually eating enough. And then the same thing would go for breastfeeding. So I am not tracking anything. I'm just going by my hunger cues. I think, did I answer your question?
Yeah, no, that's great. That's great.
Okay.
And So, and how, I mean, as you know, like, as far as teaching Pilates and working with pre and postnatal women, this issue of body image is so vital that we do talk about it and that we do acknowledge that most women have a hard time gaining the weight and then getting back to, what the term bouncing back.
Mm-hmm.
And it needs to be talked about because I think a lot of women may feel like they're the only ones that, or this is the big one, that you shouldn't be feeling shame about your body because you just did this amazing thing and you have this beautiful baby there. So then you end up shaming yourself for shaming yourself. So just, and I know like so many young girls have, body image challenges growing up. Would you be able to pinpoint where you think what do you think started your having the kind of unhealthy relationship with food?
Mm-hmm.
Because I think it's important that women know, like, looking back at their past and understanding what happened to, I'm reading this book right now called What Happened to You. And,
Ooh,
it
interesting.
really goes back to what were those things that happened that now carry us into adulthood, and making sure that we're not doing the same thing to our child like that.
Yes.
Yeah.
Mm-hmm. So for me, it's very easy. I know exactly where mine came from, but I can give you some other moments along the journey and along the way where I did have to say, oh, right, this is because of that, or do a little more soul searching. So, okay,
That's
good. When I was younger, I was overweight, and my dad made it pretty clear that he did not accept that. And so he would say things and try to get me to focus more on losing weight. Um, so that was very hard, and that kind of continued until high school. And then in high school, I was normal, but then I had all of those mental issues, and so that became a fight back and forth, or a struggle back and forth even with him, because I think he then realized, like, oh crap, I can't undo what I did, and now here's what's happening, because I just kept wanting to lose more weight and I kept dieting to unhealthy measures. And a couple of times he said to me, okay, enough is enough, like, you're skinny enough. And I was like, no, I need more. um, so that, which is really hard to then try to get over. So I definitely, if parents do come to me, which they have, and kind of discussed, on both sides, like, I'm worried because my child is a little overweight. How can I approach this in a delicate manner? And also, I'm worried because my child thinks they're overweight. And how can I approach this in the delicate manner, getting them to understand that they're not and they need to be healthy? So, my first kid is a boy. So I had always
Yeah.
thought, what would I do? How, you have to definitely be very conscious when you have a girl, especially,
Yeah.
unfortunately. So it's still, I think, good for any child to see the parent eating nutritiously, and obviously a variety, and not restricting to excessive measures, just making it a healthy, yeah, yeah. So then let's see, one moment I thought that I was getting out of everything, and that wasn't clear because I started doing this binge and restrict because of the bodybuilding. So then I had to take a step back and say, mentally, what's happening here? And that just took me, like, every time I wanted to do it, stepping back and thinking, what am I really feeling?
Okay.
And that, so just being aware and conscious.
Right. So back to the parenting. So just a thought, having a boy. What you're teaching him is how to see women, like how he
Okay.
see
Okay.
women. So
Mm-hmm.
so it is, you know, parents. I think that that's the most beautiful thing, is not only obviously for himself, but you know, you respecting yourself and taking care of yourself. Um, Hopefully he'll be attracted to women who
Mm-hmm.
do the same thing. You know what I'm saying?
Mm-hmm.
So,
But thank
okay.
you. That's
So
good. That's good to think about.
yeah, that, and, you know, although it's more common in women, you know, men have similar issues, you
Yeah,
know?
for sure.
So,
For sure.
okay, great. So I'm so glad that you're doing well now. I'm sorry that you had that experience.
Thank
That's
you.
heartbreaking. But so many people do. So many people
Mm-hmm.
do. And okay, so you're 37 now. You had your baby,
Mm-hmm.
you're 3.5 months postpartum. Let's get back to pregnancy and specifically why we're doing this meeting,
Yes.
weightlifting. And what, first of all, I want to know, did you ask your OBGYN anything about weightlifting exercise during pregnancy?
You know,
Or did they give you any advice?
I don't think I did, but I kind of knew my OBGYN outside of her being my OBGYN. She had um, taken some Pilates classes in a studio I was teaching at previously. So she
Okay.
already, and we follow each other on social media. So she already knew what I do and what I had been doing.
Right.
So the questions I asked her were more like, can I go, can I go skiing? Not water skiing. I wouldn't have done that. That's bad. Things like that. So, and I did see other doctors in the practice, and I don't think I asked them.
Okay. Did they
No.
give you advice? Do you remember getting
Um,
exercise advice from them?
yes, it was more like walk. Make sure you're walking,
Okay.
but they don't know me, they didn't know. And yeah,
Right.
so yeah, and yes, so that to your point, um yeah, I knew what was going to be said to me on a generalized basis
Right.
because I just what I knew and
Yeah.
etc. And so I just would ignore it. I didn't say anything else.
Right. Like, you know, I think that's one of the biggest struggles, is how do we educate OBGYNs on,
Hmm.
you know, I had a woman message me who's 4 weeks postpartum today, who said that her OBGYN told her she would, and she's a Pilates teacher, like super fit, right? That she would never regain the strength that she had before pregnancy. Like that she would never ever be.
Really?
Why are they like, I just don't understand. So I always see OBGYNs as like, they are the experts in organs, in the uterus, getting the baby out safely, all those things. They are not experts in fitness,
Right.
in muscles, like, and so it's
Yes.
so hard to take that advice. So getting to the fact that weightlifting is, if you look it up, it's like contraindicated, like moderation. The very first training that I taught, the book that I wrote, like the manual that I wrote for the training, I
Hmm.
remember having a picture of a pregnant woman with a big old weight behind her back and in a squat, and a big red mark crossed out over it, which what she was doing probably wasn't smart. What I saw you doing was smart. It wasn't crazy, and it but I loved that you were, you know, you, because you love lifting, that you didn't say, oh, I'm just gonna just not do this at all. That you know your body well enough to be able to take the steps to understand how to do it safely. So why don't we talk about that, like starting in your first trimester and then all the way up to that ninth month when I saw the video of you lifting. How was the progression? And how did you feel? Like, did you feel different? Those types of things I'm very interested in.
Oh yeah, totally. Definitely felt different.
Okay.
Let's start. So from the beginning. So when I became pregnant, I was like, oh crap, I should really learn more about this for weightlifting, etc. So I actually have been going through the Girls Gone Strong. I don't know if you know that
Yeah,
organization.
sure.
Okay, so
Great.
I've been
Oh, you're
doing
going
their
through that one. Oh, that's great.
mhm.
Okay, good.
Yes. So I'm past obviously all the prenatal. I read all that before,
Nice.
or it's like during my pregnancy as quick as possible. Uh, so they give you specific guidelines. The thing that was crazy was I'm reading it and it is very informative, but I still felt like I need more. So there are more books I want to read. I haven't gotten there yet. But starting in the first trimester, I was just more tired. So honestly, a lot of it, and you're going to know all of this, is just listening to your body first, which the Pilates is so helpful with that. Once you've been, like I said in the beginning, it helps to translate into your weightlifting beautifully. And then the biggest part is learning how to properly breathe, as you actually had commented on in my video. And so it was learning that breath, slowing down. So that was something that I had to learn, because when you're powerlifting, by definition, the movements are powerful. So I had to scale down the weight so that I didn't need to really like fly it up on a deadlift, if that makes sense. It
Okay.
needed to be more controlled.
Right.
So I could do my connection breath with the exhale and pull up on my pelvic floor, all that jazz, and feel that I was able to control the weight coming up.
Right. Because that probably is not great for pregnancy.
No, so a clean coming in front of your body, right, like you just demonstrated, that you can do it in the first trimester. In the first trimester, according to Girls Gone Strong, which there are a few things I agree with and a few things where I kind of disagree, but they say, it's not necessary to change any movement that you had previously been doing. They also state that someone who is new to lifting weights can start when they become pregnant. That's new because I had gone through a pre and postnatal certification like years ago, and that is definitely not what it said. It had said, do not, like, if you hadn't been lifting, don't do it. Yeah. So I do agree, but I definitely think, you need to see someone who knows what they're doing for that. Right. But then, yes, so when your belly actually starts to pop, you don't want to do anything that's in front, because you're probably going to change your movement pattern to avoid your stomach, and then you can throw things off or cause some pain.
Great point. Great point.
So okay. The clean, yes. So then I focused more on doing higher rep ranges, but they also say, and I do like this in the certification, to leave about 2 reps in the tank so that you're never over pushing, so that you're obviously at a lower risk of any intra-abdominal pressure, because you're able to stay in control.
Okay.
Right. And then so first trimester, I was just more tired, and I was just trying to get in workouts when I could. And I took the weight down a little bit. And then second trimester, the weight came down a little bit more progressively. Like each trimester, I just lifted a little bit less. I had to stop doing any kind of pull-up, I would say late in the second trimester. Like I had been doing assisted pull-ups for as long as I could. And then in your third trimester, and you'll know this as well, you want to focus more on opening. So not going as heavy for sure, and doing more exercises that are going to help with opening up your hips and your pelvis.
Okay. Yeah. And even though if I know it or not, I know anybody who's watching this or watches the replay will definitely want to know. So yeah.
Right.
So
right.
Everything is great to know. Yeah. Okay. So you said it was definitely different. What did your body feel like in general? Did you feel tighter, or did you actually feel yourself loosening up?
No, so I think I felt tighter because I also know for me personally, I have an imbalance. And so that just gets aggravated when things are off. And so obviously in pregnancy, that's going to become, um, it's just going to flare up more. And so that was starting to happen. So I think I was feeling more tight. Yes.
Okay.
That's a good question though. And that's interesting because I could say maybe at some points I didn't because I wasn't as doing as much activity as I was used to previously
Right.
and used to being tight in certain areas previously.
Right. Generally, like as a child, were you flexible or were you like not a flexible person?
My lower body is very flexible, but my upper body is not.
Huh. Interesting. Okay. Okay.
Yes.
Do this for me real quick. Can you go? This is by the way, this is a way that this is in Fascial Fitness,
Mm-hmm.
Robert Schleip's book about fascia. And they say this is how you can tell if someone has very loose connective tissue or very strong. So, so pushing in towards your wrist, that's as far as you can go.
Oh wait, pushing in towards my, yes. You going down? Oh, you're going down? No.
There you go. There you
There?
go. Yeah, that's what it is. Yeah. How
Okay.
hard is that for you to do?
That's not too hard.
Yeah.
It was,
Yeah.
yeah, it was worse here. If you couldn't.
Yeah. So anyway, I mean, and I'm not sure, like
Interesting.
they say that if you can get your thumb really close to your wrist, then you're a lot, like you have what they call a dancer type fascial web. And if you can't, it's more of a Viking type is what they call it.
Oh,
Very
interesting.
simplistic way of being able to tell. But they say during pregnancy, if you're feeling tight, it's probably because you need, your body's trying to stabilize, like because it's kind of loosening up and it's trying to stabilize. And then women, stretching usually doesn't work because it's more in the muscles. Just a little side note there. So, okay,
That's so interesting. And that makes so much sense for what I said about having an imbalance. So my body was probably
right.
trying to stabilize my hips more.
Yes. Yeah. Yeah. So when women, it's commonly everybody talks about relaxing and how you're getting more flexible or you should be opening up when so many women don't experience that at all. They experience feeling tight. So.
Yes. Yes. Uh-huh.
So,
I know.
okay. Yeah. So you were, you made the proper, variation or modifications that you needed to. And up until what day did you lift?
Where is it? 40 weeks. So whatever, what is that? At 40 weeks. At 40 weeks I did. Did I lift though? I think, at that point I was doing, like I did some box step ups. I was doing things to try to open up a little bit more.
Okay.
Actually lift. I definitely was deadlifting at 35 weeks for sure. I only know that because I posted it.
What's deadlifting exactly?
Picking up a barbell from the ground.
Okay.
I did deadlifts and I did squats with a bar on my back.
Now, is a deadlift with straight legs or is that with bent knees?
So you can do it either way. So straight legs would be called a Romanian deadlift, and then a conventional deadlift is from the floor. So I was doing them from the floor.
Got it. Okay. Okay. And the breathing that you were doing, and I'll have to somehow connect that video that we keep talking about to this discussion so people can refer back to it. But did you learn the breathing from your certification, from the Girls Gone Strong certification? That's what they teach as well.
Yes.
That's great. So, and that's great to know because I'm always so, it really is the universal way that now I'm so happy that more trainings are teaching that, and it's getting out there for women to understand that holding their breath is not the way to go. Now, where did you, so let's talk about that for a minute, that Valsalva breath.
Yes, I was just going to say, let's talk about that. Yeah, because I didn't bring that up. Go ahead.
Yeah. Yeah, no, let's, yeah. So tell me about that idea. Yeah.
Yeah. Okay. So Valsalva maneuver is when you brace. So you basically are holding your breath as you do a heavy lift, right?
Okay.
So they definitely say that's contraindicated. Do not do that while you're lifting. So you, by virtue, then have to bring the weight down, right? So don't do that while you're pregnant. So
Okay.
I would inhale as I was setting myself up for a movement. So let's just talk about the deadlift again. So inhaling as I was sinking down to the bar, and then exhaling as I would lift through the harder part of the exercise and make that connection breath. And I'm doing this because pelvic floor is what you would think about drawing up.
Yeah, pelvic floor, yes.
But another good point that you bring up with the breathing, and I didn't say this, is in the third trimester especially, it is emphasized more that you're breathing deeper into your rib cage and trying to get that breath, because for a few reasons, you're starting to get tight there. You don't want to be restricted in your breathing, obviously, and then that becomes uncomfortable in your back. But then you also don't want to be pushing all of this air forwards into your stomach so much to avoid having diastasis or like making that worse.
Right.
Is one of the things that they do talk about too.
Right. So before you got pregnant, were you like, when did you start understanding or practicing the, lateral back breathing to be able to prepare yourself?
So well, Pilates, right? So
okay, right, of course.
Yeah. So but when did I really think about that? Is it Jane? No. Jane, no. What's her name? Jane Austen? No, that's
Jane Fonda?
No, it wasn't. It's definitely not Jane Austen, but Austen, I swear it's like Austen something or the other. I think the back breathing, I don't, when did I first become, it was when I actually went through the balanced body certification.
Okay.
I don't think I had focused on it before that. So that's a long time ago.
Right. Yeah. Okay, good. Again, it's just so nice to hear when trainings are teaching that. I mean, it's really such a universal thing. So, okay, cool. So, and about how many days a week were you lifting?
Probably 3 or 4, and only for half an hour-ish, 30 to 45 minutes.
Okay. What else would you do in addition to lifting? Like, how much Pilates were you doing? Cardio, anything like that?
So, not really cardio. I kind of stopped that. I'm not I don't do too much cardio anyway. I tried running a couple of times, and that for me just did not feel good. So
just in general, not pregnant, just in general, trying to run.
No, while I was pregnant. I will.
Okay.
Running doesn't feel great for me now either, or like in general. No, you're right. But it was really just being pregnant. I felt a lot of pressure, and so I stopped. So cardio, I wasn't doing too much. I would go on walks, but my husband and I are pretty active, and so we were hiking, and that definitely felt like cardio a lot being pregnant. And sorry, and Pilates. So Pilates, then I would do like 20 minutes 3 times a week. So that's a good question also.
What kind of things would you do for Pilates?
I was doing, so I could lay on my back throughout the entire pregnancy.
Okay.
That never bothered me. So I was doing marching, leg circles. I could do planks for a while, so I would work on that. A lot of side lying series, side planks, clamshells, which isn't specifically Pilates, but side bending. Whenever I could jump on a reformer, I would jump on the reformer or the chair. The chair felt awesome for side bending.
Okay, that's right, yeah.
So I would do leg pull up as frequent, like for as long as I could. And I can't tell you how long. I can't remember. I think I had to stop that somewhere in the middle of the second trimester.
Okay. So, okay, so it sounds like you were working out pretty consistently. And then what type of birth did you have?
I had a C-section.
You did have a cesarean, okay. And so what was that experience? Was that a planned or, yeah, what happened at birth?
No. Ah, God, how much time do you have for this one too? No. So
First of all, let me ask you, have you talked about this yet with anyone? Have you like said your birth story?
I have not, I've told my clients in
Okay.
person. I haven't put it on social media, which is okay. I've said that I have a C-section and I'll talk about it at some point. So I'll talk about it now. So it's kind of a crazy story. I ended up actually switching OBGYNs at the very end of my pregnancy because I didn't learn enough in terms of how I wanted my birth plan until later on in the pregnancy. And so I decided I wanted to be at a different hospital because they had a birthing center and they had bathtubs, which I never got to use any of them. So I measured small my whole pregnancy, and then they got nervous at the end because I wasn't within the range that they really want you to be in terms of how many centimeters my stomach was. So I'll make the long story short. That turned out to be fine, but they were still nervous. I made it to 40 weeks, and at 40 weeks, generally, frequently, they really want you to give birth. So they finally convinced me to go in for an induction, and for me, that did not go well. So I experienced, I had Cervidil, and I experienced uterine hyperstimulation, and that will cause the fetus generally the heart rate to drop. So it could have been that, but then also there was nuchal cord, sort of. It wasn't around his neck. It was kind of like under him and up across his shoulder. So they really aren't sure if him coming down was causing the cord to be compressed and that was causing his heart rate to drop, or if it was the overstimulation of my contractions.
Okay.
So then it kind of spiraled very quickly into a C-section. To make sure.
So how long were you in the hospital, like from the time that you got in the hospital to when you gave birth?
9 hours.
Oh, okay. So that's actually not bad.
Yeah.
So, and here's a little tip too. I'm taking a course from Jeanette Young, I want to say. She's a C-section expert for, well, cesarean. This is what I'm getting at. She uses the term cesarean birth instead of C-section because she says that cesarean birth implies you still gave birth. You did this, rather than the C-section where it's more like a medical, like the doctors did it, almost like discounting, like vaginal versus cesarean birth. Anyway, so that's just something in general, like to remember for yourself that, you still gave birth. And then in the future, with any clients that, if they feel, not that you feel less than, but like if they feel less than that they were not able to have a vaginal birth. I mean, as a Pilates teacher, I was excited to use my pelvic floor. I was ready. And then I ended up having a cesarean. So so it's like, and I was like 24 hours. I was in the hospital.
Okay.
But the point is that, that it can be for many women, if they want to have a vaginal, they have this idea in their head about how they want the birth to go, and then it doesn't. That the term that it's still a birth can be helpful. So.
Thank you.
Yeah.
Yes. Oh, I would love to learn. So you said Jeanette.
Yeah, she's got Instagram. That's how I found out about her. And she mainly works with athletes, postpartum athletes. She's a pelvic floor physical therapist. Yeah. So I'll put it in the notes when we're done.
Awesome.
Yeah.
Good.
Yeah,
Good to know. Thank you.
Yeah.
Yes. Yep. So I have a great pelvic floor PT, and she just actually, I had an appointment today, and we went a little bit over my scar and more soft tissue massage that I can do, and etc.
That's great. So, okay, so you went through, did you want to tell us anything more about the cesarean birth, about your birth?
No, not yet. No, that's okay. That's pretty much it.
Okay. So, when did you get back to, have you lifted again yet? Are you lifting yet?
So yes, but I did have to back off because I tried a little too soon. So
Okay.
yes. So I'm just doing, I had tried to do the barbell. And the thing is it wasn't bad. It's not really bad. I just felt, I think, being really in tune, like, okay, I was starting to feel too tight in my pelvic floor, which I think is something that happens post cesarean birth with people. So I was noticing that. And then I was noticing just that one part of my scar was not feeling great. So I've backed down the weight.
Okay. When did you start? About what, how many weeks were you postpartum?
Many weeks. So I did 8 weeks. 8 weeks I started actually, yeah, like trying to do more, like adding weights in, because previous to that, in the first 6 weeks, I went back to the connection breathing, and that made me super sore. And then I was just practicing connection breathing in different positions that felt good, and that all felt great. And then I started to add in just a little bit more core rehab for probably the next 2 weeks. And obviously that's still continuing. And then I finally felt comfortable picking up some weights.
Okay.
But that at that point too, at that 8 week period, I still was just really building up slowly. And I would use my baby a lot as my weight.
Good. Yeah. So, I mean, that's the smartest thing you can do. And I think that's most women's issue, is feeling like they want to hurry up and get back to what they were doing before, when that's when you that's when the problems arise. I always tell teachers that really your pregnant client is the easiest to work with. It's postpartum that you just have to be careful. So, but It sounds like you did an amazing job, just starting with, like you said, the connective breathing. About how often would you do that? Did you do it daily? Did you have a certain time every day that you would do it? How did you manage that?
No, sadly, because I think, when you're a first time mom, you're like, what just happened? I a couple of times a week. I'm sorry, I don't even have a better answer.
That's okay. Yeah.
Yeah, and then just whenever I felt like I could.
Yeah, good. Good. So you're feeling good now. You said you're working with a pelvic floor PT, which I always recommend women do. And how are you feeling emotionally?
Much better. I think initially I was definitely hit hard because yeah, that wasn't right. Like that wasn't how I saw my birth going. And because I had such a healthy pregnancy, I had the idea that it was going to be fine. And I definitely learned has nothing to do with it. So now I feel great.
Good.
I think for a little while it was hard, but I worked through a lot of that. I do have a therapist, which I highly recommend. And I had a doula for my birth who really helped postpartum also.
Great. You had a therapist after pregnancy? I mean, in the postpartum period, or just in general?
In general, I have a therapist.
How often do you see the therapist?
Now it's maybe once a month. So it's not, super frequent.
I think like just the idea of having a therapist and mental health, I think is becoming a lot less taboo. And so it's always just really great to hear when, successful people are seeing therapists. It helps women to understand like this is how you take care of yourself.
I'm a huge fan. Actually, it's funny because I was listening to one of Leslie's. So Leslie Logan is our business coach essentially, And she has a podcast, and she said recently that therapy is like doing your laundry. Like it's something that you do and you have to do frequently and you have to upkeep it. So I like that analogy.
Yeah, that's a great point. So, we'll go ahead and wrap this up. I know 45 minutes I've had taken you away from your life, but this is going to be really helpful for a lot of people. So tell us, first of all, where are you in the world? Remind me.
Connecticut.
Connecticut. Okay.
Connecticut. And you're in California, correct? Sorry.
Nevada, Las Vegas.
Okay. Okay.
And then you work in, tell us about like where you're working, who you see, and then how people can contact you.
So I am working virtually, as we all are now. And then I also have a studio in West Hartford, Connecticut. And then people can contact me. You can find me on Instagram. As you stated, it's holistic. So I'm sure that'll be on your notes there. And then my name is Elizabeth Buchan. And yeah, if you contact me on any social media platform, I can respond that way.
And are you doing nutrition as well? So like, what does your program entail?
So I don't do nutrition officially because I am not certified. So that's kind of without my, that's not really within range of my scope, but I am definitely happy to guide and give nutrition help as frequently as I can. Yes, but generally the way that I train people is doing like half an hour of Pilates and then half an hour of weight training or corrective exercise, kind of whatever they need within that hour. But that's typically how I work. So it's half and half.
Got it. Okay. That's beautiful. So thank you so much. This was really cool. And I'm going to figure out how to actually keep it and download it. I know there's a way to do that. So yeah, thank you so much. It was really eye-opening, and I'm just so great that you're doing so well. And I really enjoy all of your posts. They're very inspiring, and just thank you for sharing your life.
Thank you so much. Thank you for having me. And I love learning from you. I love your posts. They're incredible, so educational. And I'm excited to have you, or I'm excited to interview you.
Oh, cool. Yeah, that's right. That's right. We talked about that. Cool. Yeah. So we'll do a little flipperoo soon. That'll be awesome. And I have your text message now, or you have my phone. So that's probably the fastest way to get a hold of me. And then Instagram message would be the next, but okay. So I'll let you go. Okay. Thank you again so much, Liz. I'll see you soon.
Thank you. All right. Bye, Allison.
Okay, bye.
Bye.